Word leukemia comes from the Greek roots leukos, meaning white, and haima, meaning blood. That's also where we get heme in hematology, study of blood. It was coined by Dr. Virchow, who's a very famous German physician, also credited with Virchow's triad. It comes from the observation that in this type of cancer, leukemia, there is an excess of white blood cells in the bloodstream. Acute leukemia is typically not subtle, and it's not going to be confused with iron deficiency anemia because it's going to present with abnormal white blood cell count and usually abnormal platelet count. Most patients with acute leukemia will also be anemic, but they will have other blood cell abnormalities. Often they will have circulating blasts, which are going to be caught on the CBC automator. AML can present with low counts, low white blood cell counts, anemia, and low platelets, but AML does not present with isolated anemia. Of the chronic leukemias, chronic myeloid leukemia, or CML, is going to present with elevated white blood cells, specifically elevated neutrophils and something called left shift on the differential. Chronic lymphocytic leukemia, CLL, is going to present with increased lymphocytes in the peripheral blood. MDS is another chronic leukemia, and this is the only circumstance in which a patient may, although uncommonly, present with isolated anemia, normal white blood cell count, normal platelets. MDS is a disease of aging, and so often it's going to present in folks that are 65 plus, and usually patients with MDS will not be iron deficient. They may even be iron overloaded due to ineffective erythropoiesis that promotes increased iron absorption in the gut. I often say iron deficiency anemia is a problem, not a diagnosis, because identifying iron deficiency anemia does not identify the underlying cause. If you look at somebody's CBC and they're anemic, but they also have an abnormal white blood cell count, either too low or too high, or an abnormal platelet count, you have more than just iron deficiency anemia going on. But if you have isolated anemia, especially if it is microcytic, meaning your MCV is low, although you can have iron deficiency anemia and have a normal MCV, or even a raised MCV in some cases. If you have anemia and your ferritin is less than 20, or your transferrin saturation is less than 20%, that is diagnostic of iron deficiency anemia. The underlying reason for that, the underlying diagnosis, can be one of many things. I have a lot of other videos about this, and it behooves anybody who tells someone they have iron deficiency anemia to figure out why. Hope that helps. Follow for more information about blood.